Good morning. Good morning. It is July the 2nd here, a new month, and this is Healing Shame with your boy Jeffrey B. And what I'm going to do today is just try to walk you through um, my pre-treatment plan, treatment plan, what some of the options were regarding my Invisalign journey, and then what we went with ultimately. And this is coming from one of our fellow viewers, a request made by a fellow viewer to kind of walk through what this process looked like, what the treatment is, how many trays, things of that nature, the dentist I've gone to, where it's been done. So I'm going to do the best I can there, try to put some things up on the screen for you, like the initial plan, which was IPR, interproximal reduction, shaving down quite a few of the teeth, the surface between the teeth, and then closing up the gaps sooner. But it wasn't as good of a long-term solution from my dentist's perspective to heal up some things in my mouth and all that. So we'll talk about that, and I'll put the X-ray up, and I'll talk about why he chose to do an extraction versus IPR, and I'll just try my best here to put this together for you, and hopefully it helps somebody make their decisions. So here we go. Let's get it going. I think the best place to start off here is, why did the doctor choose tooth extraction versus IPR? Some people are like, they'd rather move it than lose it. Teeth are precious. They don't want to lose any teeth. I sure as hell didn't want to lose a tooth. But I think the thing to look at most importantly, of course, is there enough bone in the jaw to hold all the teeth in a severe crowding condition? He said my teeth were severely crowded. There wasn't any space for them to go, and there wasn't enough bone to hold all the teeth in the jaw if an IPR was performed. So I've had some viewers ask about this. They thought tooth extraction and overcrowding is an outdated practice. If you have enough bone in the jaw, they should probably not be extracting a tooth. Tooth extraction is a down and dirty way to gain the space needed for orthodontic treatment. It's very quick. You gain a lot of space, especially if you extract a lateral incisor that's out of place. Now, be warned, and this is something to consider if you might go through this process. If you have any recession or anything wrong with any of these, not the lateral, but the medial incisors, the ones towards the middle. If you have anything going wrong there, if you pull any of these lateral incisors, you're going to destabilize that system. Nature knows best, and sometimes we got to destabilize the system to restabilize it long term. That's what's had to been done in my case. Okay, so when I pull that incisor out, this tooth next to it, the adjacent incisor, which is a medial incisor, one of the middle ones, that is now loose and hurts. That's normal. Some of that is normal after extraction, and that's going to firm back up once that ligament and the bone remodels and it fits down in there. Of course, it's going to be a dynamic process. But if you look there in that x-ray that I showed there, you're going to see there wasn't enough bone down in here for all these teeth. If I were to keep all of them, there wouldn't have been enough bone to hold them all in properly. That's why he chose extraction. That's the first thing to look at. So after Dr. Wasset, which is my dentist's name, Dr. Wasset here in Chiang Mai, Thailand, that's where I'm doing my Invisalign, we're at least getting started. Now, after we ruled out, we had two choices. We could do the IPR on quite a few of these teeth, shaving the teeth down and the top. It would have required IPR on the top and the bottom to make everything fit properly. So after ruling that out due to spacing issues down here, not enough bone for the teeth to root back into after the bone remodeling and migration and movement of teeth. We ruled IPR out, and he went for extraction. I did post the lateral incisor extraction video. If you're interested, graphic material, viewer discretion is advised. If you're squeamish, don't watch it. I don't want to watch it again myself. I already went through the pain of it and the cringe worthiness of it. Would never want to do that again. But hey, we sacrifice sometimes to get a better result ultimately. Um, I just wanted to also briefly mention that, I asked a lot of questions, guys. So if you're like, why didn't you ask enough questions? Or you should have challenged, got another opinion. I got other opinions. I asked a lot of questions. And ultimately, I had to make the decision. You ask as many questions as you need until you feel comfortable moving forward. If you don't do it. Go to another dentist, wait, just don't get this done at all. For me, I wanted to face my fear, push forward on it, because the dentist told me that if I don't do anything, eventually there's going to be more recession and I could start losing teeth a little earlier than I'd like. And I figured, let's go ahead and hit it head on now and tackle it so that I can stabilize my teeth in a better way, get some more work done on my gums, and have my teeth longer. So I'm going to have to deal with more pain in the short term to have a better long term result, better consequences long term. That's kind of the trade off here. So, um, anyway, that's something for you to consider. I had to do it myself. It's not easy. I understand. Just think, get all the pros and cons, talk to others. Um, but what I've done here is I've also put up for you uh, the treatment plan. Okay, so he had the pre-treatment showing what each stage is going to look like, and then all that was going to get sent off from the software to the lab so they could print my trays. For me, we've got 24 trays, upper and lower, and 2 weeks for each tray. Okay. And I've got all of my trays for a year. I've got all 24 right now. Now, there are two extras, which were overcorrection or something like that trays. So those are the last two, 25 and 26. But I have the first 24 with me in case I don't need to come back here to Chiang Mai, Thailand, which honestly I kind of like to go. I'm tired of the place a little bit, been here too long, waiting to get this started. And now I can take all these with me and move forward. The only drawback now is, like I mentioned before, and I think I can show you actually right here. I have these first few trays. See, here's tray 2 and 3, for example. Okay. And you've got your upper and lowers in there. Now, on tray 2, you can clearly see that the lower one has got a pontic in there. You see that hard resin type material? That's actually hard. That's not soft. That is blocking up the space for my incisor that's loose right there to even fit in. You can see that's not going to go in right. So that's going to be pushing on that tooth this way. And that's what it's doing now. The pontic is pushing a little, which makes there a little bit space between the top of the aligner and the top of my tooth. Now that's going to have to be modified and shaved down. Each one of these has got a pontic all the way till tray 5. Tray 5's got a pontic as well. That's that fake tooth in there. So once we're through these trays, there won't be any more pontic. If you have a pontic like I do that is blocking or making or precluding a perfect snug fit for your lower tray, you're going to have to ask your dentist to modify those trays, that one or however many. And that's what I'm going to have to do. What else can I say? So we've got 24 trays, 2 weeks per tray. There's a lot of work involved to eating now. You can't just grab a snack in the street. You can't grab a yogurt or a juice. You're supposed to take these things off, or anything, even yogurt, fruit, smoothie, juice, whatever. You've got to take them off. Some people probably cheat. I don't want to discolor mine, and I don't want to discolor. I don't want to take a chance. So I'm just going to try to be strict on myself and take them off and follow the process. 2 hours a day you need to wear these 22 hours a day. You got 2 hours to eat, brush, clean up, and put them back in. You got to time yourself. What timeline are we looking at? So, I've shown you the things here. You can see on there that we've got, these are the stages, and you can see in the stage here at about stage tray 14, I think, which is going to be about 6 months ish in, this should be closing up. Now, he did not put attachments on this or over here. I think to reduce the force here, he left some attachments off. I'm not sure why. Maybe I need to ask and follow up on that. I'm not sure if we're going to be tracking properly because these attachments are not on. If he had an attachment on this tooth, of course, it's going to make it move faster, but it's also loose. If you make it move too fast, you could risk it coming out or the bone not moving properly. So he had to make a judgment call and let the attachments off, partly because it's painful, this tooth, and he wants to make sure that the bone migrates with the tooth, so it holds in my jaw right. Yeah, this is a calculated risk, y'all. You got to make your best decision on if you want to move forward on this. But that's what my treatment plan looks like. You can see the progression. You got a couple of different angles and views there for you to see, and I hope that helps you understanding what a treatment plan looks like going forward. So just to briefly mention where I'm doing this, the name of the place is called Dental Excellence by Lerts, Lerts, here in Chiang Mai, Thailand. Dr. Wasit, Wasit. There are two dentists. He's an implantologist mostly, but he's done over 600 Invisalign cases, so I'm trusting his judgment here and that this tooth can survive the migration. I did look at the x-rays. These are pretty long rooted incisors. You can look in the other video to see how long that lateral incisor was that was pulled. I'm hoping there's enough root down in there for this medial incisor to survive this migration and hold into my jaw and the bone properly. Of course, that's been my biggest concern, and I question whether he pulled the right incisor. It's done now. I've got to move forward the process. There's no other choice. The only other choice now would be to put an implant in there, or he pulled a tooth. That's just going backwards. But then again, yeah, if you put that in and stabilize the medial incisor so you don't lose two teeth, it's all big what ifs here, people. You just got to go with your best judgment call, trust your dentist, trust your orthodontist, get second opinion to move forward if you feel comfortable. I'm no professional here. I'm doing the best I can. And I'm trying to heal my shame by practicing self love and give my inner kids a gift of a new smile, which maybe I didn't need in the first place. But I'm committed to it now. So we're just going to just keep on pushing forward. Price wise, it's going to cost me altogether, including everything, including the retainers at the end. It's going to be about 3,500 US dollars, 3,500 USD. You can do the calculation, whatever that looks like in your local currency. That's about 119,000 Thai baht. Of course, I'm putting it on my credit card in case there's any problem. I can dispute the charges. And if something goes wrong, malpractice, this, that, whatever, I lose a tooth, I'm disputing everything and I'm not paying it. Anyway, that's all I have to say, guys. I wish you the best of luck on your journey. There's your money. There's the doctor I went with, the place in the world I'm doing it. What is it going to look like follow up, though? I should mention that as well. I have another appointment to ensure that my second tray fits on July 13th or the 14th. That's 2 weeks after having worn tray one. And then we're going to shave down that pontic, hopefully before the appointment, shave that down, get it to fit right because he's got a few trays to modify. Shave those down. I want that to be a perfect snug fit, just like the top tray is perfect. I want this thing snugging down on there just right. I don't want any chance of not tracking properly or migrating teeth because I want to close this gap ASAP. The sooner the better, so this tooth has a partner and bone together so it's stronger in there. I don't like it loose and wobbly. It's very uncomfortable. I don't want to lose it. So I have a follow up in a couple of weeks, and we're going to make sure that second tray fits. And after that, I'm probably going to come out of here, leave Thailand. At that point, I could leave Thailand uh, and hoping for the best, hoping that the following trays are going to be fitting right. If they're not, of course, there's going to need to be modification and revision, and I'd have to do that here or get it done overseas at a dentist that'll participate in it. And that might be more costly or just a little extra price. I don't know how that'll work. I really don't. But I'm hoping we can just go through this process and things are going to fit nicely. I'll need a backup plan if they don't. We'll have to figure out what to do. Because, see, if they don't, they're going to have to reprint the trays. And so if they're going to reprint the trays, God, that's going to be awkward because they're going to have to reprint an American, ship all the way back to Thailand. So it might be better for me to reprint in USA and be in the USA and get them while I'm there. It's going to be a lot less time. So we don't know how this is going to go. I don't know. I'm just trying to turn it over to higher power and go with it. But I'm going to stop there, guys. I've probably gone on too long. I hope you got something helpful out of this. And until next time, all the best.